And why is it important? Because each one of these have independent phases of which we incorporate them into the intervention process. When we start using these correctly, we can meet goals very quickly. So, let's just understand that for our checkoff, what we're going to have is all of our critical safety elements, but then you're going to do isometrics, you're going to do concentrics, you're going to do eccentrics. And it's important to know where to put your hands. And the only way you know how to do that is to practice, right? Just like what you did with passive range, you were putting your hands in the right spot. Okay? So, I'm going to ask for, I'll tell you what, can I use this table? Who's usually here? All right, well, Noah's going to come be my mom because he wants out of that chair. Are you in it because you have to be? No. Oh. I should have used Stephanie. Are you in it because you have to be? Next time, maybe. All right, so go ahead and lay back for me. All right, so while he's kind of getting ready, with isometrics, one of the primary purposes there, and I want you to write this down next to isometric contraction, is when you have goals to reduce or inhibit, which is the same word, muscle spasm or muscle guarding, or to decrease pain in a muscle. Yep.
When you have goals?
When you have goals from your plan of care, when you have goals to reduce spasm, that's in the muscle, right? To reduce muscle guarding, or to reduce pain in a muscle, you can use isometrics. That's when you can use it, okay? Now, do me a favor and tell me this. What is an isometric contraction? It's a contraction that occurs in the muscle, but there's no movement at the joint. True or false? Or no, let's not do true or false. Is there loading?
Yes.
Yes. Yes, there is. Do you suppose that loading is maximal or submaximal? It is submaximal. Remember, it cannot be maximal if it's occurring in the max protective phase. Because you can't maximally protect a joint or a muscle and ask it to do a maximal effort contraction, right? Does that make sense?
Yes.
All right. Go ahead and sit up for me, buddy. Sorry, I'm moving you around like crazy. So, here's some examples of how to do isometrics. Let me first start, because in your checklist, you see head listed. Now, just so you're clear, we are talking about the temporal mandibular joint at this point. And so, what motions happen there? Well, you know, go ahead and say it. What is that? What is that called?
Open impression, but I don't know.
I missed the question.
What is open and closing the mouth called?
Snap. I think we've got us a conundrum. Tell you what, you think about that. I'm going to give you one and maybe it'll hint it out. All right. So, terrible news. You're not going to be able to see this. What I want you to do is protract your jaw.
What you do is stick your teeth out like this. Did you see what I'm doing? You can't. You're right away.
Should have wore my face shield. Taking that jaw and pushing it forward. Where you have a big underbite. Go ahead. Alright, now push it out and hold it. Hold that. 5, 4, 3, 2, 1. Relax. Push it out again, underbite, and you saw it move. Right? Good. Now go ahead and open. Hold that open for me. 5, 4, 3, 2, 1. Right. And again. 5, 4, 3, 2, 1. So we're looking at the jaw when we say head. Okay? Now when we talk about the neck. Would you come sit here? Isometric contractions. On your list of questions, it says, how long should they last? Doesn't it say that?
Timeline of usage.
Okay. I forgot to put that one in there, I'm sorry. A isometric contraction is 6 to 10 seconds. 1 more second than 5. So the way I do that is I will apply pressure, and once I start applying pressure, then I start with 5, 4, 3, 2, 1. All right. Now, notice the graduation of my pressure starting. I'm pushing, and then I degraduate it on the way out. You don't want to do this where you say, okay, match my pressure. Because they don't know, even if you say 5, 4, 3, 2, 1, when you let go, they're still at contraction. And that can cause a over sequencing in that muscle and can actually cause strain. So remember, you're doing this, the timeline of usage is subacute. Meaning like you let all the acute things happen and then you come in with it. So it's subacute. Like it's one of the very first things you're gonna do. So if you're doing that, let's make sure we're gentle, okay? So as you're doing this, graduate up the tension and then graduate down tension.
Subacute means during acute.
That means right after. Right after. So you have acute, that means Ryan Toon sprained his ankle, 72 to 96 hours, somewhere at the tail end of that, but before going into proliferation, that's when we're going to start. All right, so here is lateral flexion, frontal plane. 5, 4, 3, 2, 1, and I graduate out. Lateral flexion, frontal plane. 5, 4, 3, 2, 1. Flexion, sagittal plane. 5, 4, 3, 2, 1. Graduate out. Extension, frontal plane. 5, 4, 3, 2, 1. Graduate out. Do you see how I'm also moving my other hand? And what am I doing there? I'm stabilizing. Okay? The alignment happens by me putting him where I want him. Like what if I said, turn your head this way and let's go here. That's alignment. And later we're going to talk about multi-angle isometrics on Monday. No, on Wednesday. And that's when we'll cover that. Okay? All right, so you saw that. What about rotation? I'm going to go ahead and just rotate him just a little bit. Okay? And then I'm going to stabilize as well as 5, 4, 3, 2, 1. And I'm pushing this way. Right? So I've got him kind of turned a little bit into it. Right? And the reason you want to do that is basically so you actually get him cued, tactile cued, that he's going to rotate. Otherwise, if I go right here, he's going to push. When I start pushing in, it's gonna give confusing signals, right? So what I do is I take and turn him, there's my alignment, and I say, now resist my motion, and I feed in gradually, and then graduate out, okay? Right? All right, so those are some easy ones. Let's talk about some more complicated ones. Go down to the bottom of that graph. It says ventilation. Oh my. What are we going to do here?
You're gonna stand on top of his diaphragm.
Before I do that, let's talk about this. In physical disabilities, you learned about accessory muscles for inspiration. You see, let's review real quick. We're going back to physical disabilities. It's very important stuff. You have muscles of inspiration and you have muscles of expiration. But expiration is such a just negative pressure release. When you breathe in, you don't have to do much to breathe out. Because what happens is you fill up your lungs and then they basically, like a balloon, do what? Deflate. So expiration is just not that much. But inspiration, that's a big deal because you're gonna have to use muscles to get it in. You should be using the primary muscle of inspiration, which is the diaphragm. So let's all try this together. Right? Now you've learned this, correct? What am I about to teach? Diaphragmatic breathing. Okay? It's a inspirational technique. You're teaching that patient to use their weakened diaphragm to breathe with. Most of us, if we've not been practicing this, have a weak diaphragm. The way I like to teach it is I like to lay a patient supine, actually hook lying. Remember hook lying? That's supine with knees up, right? And I like to tell them to breathe in and breathe out. But make that belly expand, right? But in this instance, let's pretend that we already know the diaphragm's weak. And so we can work on accessory muscles. What are they? They're your upper traps, the levator scapulae, scalenes, pec minor, intercostal, external intercostals. Those muscles are all accessory muscles, okay? So I'm gonna put my hands right here. And I'm gonna say, go ahead and shrug your shoulders up and hold that tight. Okay? I didn't say match my resistance on that one. I gave you another cue. So up there where it says cueing, match my resistance is great, but also hold is great. All right, so come on up here. Now, what we know is accessory muscles probably aren't the best one. Lay back more than 2 1. Probably aren't the best thing to like feed into. Eventually, we need to address this right here. Okay, so muscles of ventilation. I definitely want to see you doing this, and that's about teaching. So. Sir, what I'm going to have you do is I'm going to have you lay your hands down right here. Go ahead and bend up both knees for me just like that right there. Go ahead and lay your head back. And just go ahead and take a deep breath in for me. Good. Now exhale. Okay, so next time what I want you to do is I want you to take a deep breath in for me, but I want you to push out against my hand when you take your deep breath in. Push out, push out, push out, push out. Now hold it. 5, 4, 3, 2, 1. Now relax and exhale. Excellent. Go ahead and take another deep breath in for me. And at the top, hold it. Push out my hand, push out my hand, push out my hand. Good. Now hold that. 5, 4, 3, 2, 1. And relax. Exhale. I feel like a yoga teacher. Let's do this one more time, just for good measure. Inhale in, big belly out. Come on, push that belly out. Good. And 5, 4, 3, 2, 1. Now relax. Good. Okay? And that's how you teach diaphragmatic breathing, but that's also how you strengthen diaphragmatic breathing. Right? If they're using accessory muscles to inhale and you see that, one of their goals will be diaphragmatic strengthening. How do you strengthen it? There's your isometric technique right there. Feel pretty good? One more just before we break up into small groups. So I will do this from two positions. One, seated. I don't like to lay patients down unless it's just like that's what you got to do. Mainly because there's always that like concern of when you get them back up, do they develop orthostatic hypotension? Also, it's just kind of awkward. I know you've probably felt this way when you're lying and someone's kind of working. It's just kind of awkward. And so if I can sit them, I prefer it. I know that's what I would prefer, and so do unto others, I will sit them. You could do this with the patient supine. So with isometrics of the shoulder, every time you get a brand new rotator cuff tear, who's had it repaired, and they're in for surgery, this is what you're going to start with as soon as isometrics, as soon as past every is finished. Okay? So, what I'm going to do is I'm going to get my hands and position to both stabilize, but also align, and then resist. Okay? So, I've got my hand right here. Do you see it? Sorry for the people behind me. What I'm going to do is I'm going to keep him aligned and stabilized by putting my hand or my shoulder right here next to him. You see me? Rosie's got a great view of it. And I got my shoulder here, and we're stabilized, and I'm probably dealing with somebody with really poor posture, so I'm like, sit up. See how cueing works? It's terrific. Now I'm pushing. Now I want you students to tell me. Match my pressure. What am I doing? Tell them, Noah. Well, yeah, that's isometric. But what motion am I pushing against? What motion were we doing? External rotation. See my hand here? It's on the back of his hand and wrist. You see it? And I probably could just go to right here, but I'm pushing in. So go ahead and relax for me. I'm pushing that. He's externally rotating. What muscles? Teres minor infraspinatus, the its muscles, remember? I'm pushing in, graduating it, and degraduating it. 5 seconds on, actually 6, up to 10, and then I just back out. And really, once you start working with these patients, they know what to expect. So there's external rotation, and then watch this. I can just make one simple move, right? Here's internal rotation. Did you see it? That's all I did. Right there. So subtle. So subtle. Okay? And then, I don't know if you can see this, just watch. I move my right hand. It's at the posterior aspect of his humerus. And I tell him, I made a change now. I want you to resist me pushing right here. And I just give him a little bit of tactile feedback of where my hand is. What am I doing now? Extension. Isometric for extension. Okay? Now watch. Watch. I just moved my hand. And I went straight from extension to what?
Flexion.
Yep. See there? time. That's my pressure. Where am I at? Abduction. See how all that went? Real subtle, real quiet. I like keeping my isometrics quiet like that because we're at the beginning. We're in the max protected phase. We're in the subacute phase. So just keep it subtle and easy. You'll be just fine. Alright? So, group up. Work through those. Ask me questions as you go.